So New South Wales recorded those 35 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 33 cases are linked to a known case or cluster, and 20 of these are household contacts, again highlighting the risk within households. 2 cases are under investigation and 2 new cases were acquired overseas. We've had 58,373,000 tests reported to 8 p.m. last night, so that's, I think, going to be a record for a Sunday. It is important that we do not get fatigued with our testing. Please continue to get tested, and even if you've had a negative test, if your circumstances change and develop symptoms subsequently, please get retested. We're also calling on businesses to please support their workers to take time off and get tested, and actively really send that message that we as business owners will not want infectious people into our premises, and we're not going to look negatively at you if you turn up and ring in sick because you've got the mildest of symptoms at this critical time. We also have 4 people in ICU, none of whom are ventilated. Of today's 35 new cases, 24 were in isolation throughout their infectious period, and 4 cases were in isolation for part of their infectious period, again highlighting the importance of us getting to cases very soon, because even by the time we get to cases, often they've transmitted to their family and their family might be in isolation for 1 day, but we need them in for that full infectious period. And 7 cases were infectious in the community. There are 2 new cases in residents of SummitCare Baulkham Hills aged care facility, bringing the total number of cases associated with this facility to 5. Of the 2 new cases, both women in their 70s, 1 was a resident is fully vaccinated and 1 has not been vaccinated, and the resident who's not been vaccinated was entered SummitCare in mid-May. The 3 previously reported cases were fully vaccinated. Out of the abundance of caution, all of the 5 residents have been transferred to Westmead Hospital for observation, and an additional wife of one of the cases has also been transferred. There were 2 new cases associated with the birthday party at Hoxton Park, and this again highlights the fact of why we need those 14 days. We still are seeing cases get diagnosed and recognised through our surveillance testing, as some symptoms will be incredibly mild or some people will be asymptomatic. So the importance of complying with those exit swabs and going through that clearance process is highlighted. We also need to say that, again, to highlight the Gold Coast to Sydney flight, VA524, we have 5 new cases on that flight. Now, it's been pleasing to see that when we've contacted those individuals, we had already identified them as close contacts and they were isolating and therefore pose no other risk to the community. But my message is, even now we may continue to see cases arise from that plane. So again, don't think I've been in isolation for 7 days, I haven't had any cases. You've got to stay in there for that full 14 days and get those clearance swabs. In terms of Rose Bay Public School, we issued an alert that there was 1 new case to 8 p.m. last night, is a student at Rose Bay Public School. The case is a close contact of another previous case, and for the abundance of caution, we're not exactly sure about the full infectious period, but that person may have been infectious at school, and hence the usual process around investigations and calling the close contacts for the child's year group. In relation to, there was an event at 8 p.m. on Saturday the 26th of June at Meriton Suites Waterloo, a gathering, and we have 3 new cases linked to that. And we're going to be looking intensively at that event, and we'll provide some updated advice later today. We're just reviewing the results from extensive testing around those cases overnight. Just a message again to younger people, and can I thank the younger people again for playing their part in responding and helping us keep their loved ones safe and their close social network. It is important to remember that young people themselves can get sick and be hospitalised following COVID. So whilst it is that older people are going to be more likely to have severe outcomes from COVID, hospitalisation and deaths, I just want to remind young people that they too might be seriously impacted, and we have seen cases range from the 30s hospitalised and in ICU for a short period of time. In terms of construction sites, we're alerting people to the fact that there was some confirmed cases at a construction site in Cindy while potentially infectious. So one person worked at construction sites in Auburn and Tuangabi in Sydney's west. Anyone who worked at the construction site at 59A Street at Auburn from 11:30am to 2:30pm between Monday the 28th of June until Friday the 2nd of July is a close contact and must immediately get tested and isolate for 14 days, regardless if they receive a negative result. Anyone who worked at the construction site at 74 Aurelia, Aurelia Street at Tuangabi from 7am to 12pm between Monday the 28th of June until Friday the 2nd of July is a close contact and must immediately get tested and isolate for 14 days, regardless if you have a negative result. And if you worked at this Tuangabi site at any of these dates and at any time outside of the 7am to 12pm, you are considered a casual contact and must get tested immediately and isolate until you receive a negative test result. This again highlights that we do have essential activities continuing, and we do again urge everyone to be very vigilant for signs and symptoms, and I appreciate the cooperation of those workplaces. We were able to get line lists of people that worked at those workplaces, but just in case those records are inaccurate, we are making that public announcement. We are also asking the household contacts of those who attended these 3 construction sites to also immediately get tested and isolate until they receive a negative result. We're doing this because what we're trying to do is get ahead of the spread. Because some of these exposures date back to Monday the 28th of June, there's sufficient time for someone to become infectious and then passed on to the household. So we're asking that the household also isolate till we clear that the person who worked at the construction is negative. It allows us just to get ahead of any spread that might have occurred because that exposure extends back to Monday the 28th of June. I'll leave it there. Thank you.